case study NuR 241. We have to write 2000 words. Case study says you're working as a nursing student for Hindi. An Aboriginal woman. We have to understand that this is an Aboriginal woman. You can't write general sentences. Their way of being handled is different than a normal person. She was admitted to the ward 2 days ago with a chronic heart failure. We are going to underline chronic heart failure. She has bilateral edema of legs and nocturia. She has complaints of feeling short of breath and is fatigued. Blood pressure is 135 by 70. Pulse is 98. Respirations 32, and other directions have been given to us. What do we have to do in this assignment? Use the information, write a better explanation of the pathophysiological changes that occur in the body. Additionally, provide a written explanation for each of the subjective and objective data presented in the case study. This is criterion 1. Then criterion 2, you have to do nursing assessment for 500 words, nursing diagnosis, plan, intervention, evaluation. Then we have a criteria 3. You have to use relevant sources. We have to use Sinehal and PubMed. We can't use anything else. And in this assignment, you're required to demonstrate an understanding of the standards and how they apply to your nursing practice. Now, I am going to tell you how I did this assessment. Okay, we are going to start the screen sharing. Just give me one moment. Let me see what I did in this assessment. And I can explain you how this assessment has to be done. And if you have any similar assessment, then you can let me know. Okay. Now let me start the screen sharing and you will be able to see how I have handled the assessment. Okay. Now criterion 1. We have done the application of pathophysiology of the patient's condition to the case study. You have to explain the pathophysiology of the heart. Okay, you have to combine all the things and then you have to mention the cardiac output due to reduced cardiac output in the heart failure. 2 most important: regulatory compensatory mechanism is activated, sympathetic compensatory mechanism, and RAS compensatory mechanism. Then if you come, we have taken all the note of the important points that we were given in the case study. You have to apply all the relevant points of the case study. Then you come to the criterion 2, where we have to understand what has been done for nursing assessment. Then we have to come for nursing diagnosis. You have to make a plan. You have to do interventions. In interventions, you have to remember that it is very important that you do a comprehensive care plan for Mr. Indy. And also you have to write the NMBA standards. You have to apply them. Okay, and then last May we do an evaluation. Please, if you have any nursing assignments, then come back to me.